Team okay? Start now? Okay. Hi, everyone. So I'm Kathleen Brown, the chair of the Needham Board of Health. This meeting is being conducted remotely per the governor's executive order of March 12th, 2020, due to the COVID-19 pandemic. We're able to meet not in a physical location due to that emergency. And let's see, I will introduce each member that is on the agenda and just respond by saying yes, so we know your voice. So I'll start with the board. Steve Epstein.
Here.
Rob Partridge.
Here.
Ed Cosgrove.
Here.
Christina Matthews.
Here.
Okay. I don't know who else. I'll just go through the staff. Talib. Just say yes. Hey, Tara.
Here.
Okay. Mary.
Here.
Okay. Carol.
Here.
All right. Hannah. First Hannah Burnett.
Hey, here.
Second Hannah. You guys
Also
are
here.
Thank you. Karen.
Yes, here.
Okay. And then obviously Tim. Just say yes. and Lynn.
Here.
Hi, Lynn.
And don't.
Great. Okay. I'll switch over to the agenda. Let's see. So we have two sets of meeting minutes to review from the March 11th and 26th meetings. Did any board members have edits or comments?
No.
Nope.
No.
Okay. Any?
Move approval.
Okay. Do I have a second?
Sure, I'll second.
Okay. Great. So all those in favor? Steve?
Yes.
Rob?
Yes.
Ed?
Yes.
Christina?
Yes.
Okay, Kathleen, yes. So those are accepted. Let's see. We will move on to, I guess, staff reports. And we are first up with, sorry, I'm in the minutes.
Taleb should be first up, I believe.
Talib. Okay, great. Hi, Talib.
Just a second to open my report. Okay. Good morning, everyone. Let's walk you through our summary of work over Mars. First of all, number one, we assist with our last clinics over last 2 weeks for the housing authority. We have done the second dose for the 100 people. Second, for mass response, we completed our transition. So right now, everything is through our mass response system. We still have the control on our MRC volunteers to activate them, but all their database, it's on the mass response. For the status of our MRC volunteers, we have gone from 20 volunteers on January last year to 160 volunteers today. We have 37 of them. They are still pending. They have to finish their CORI background check. We have 76 of them non-medical volunteers, and we have 47 medical volunteers. Now, as you can, let's have a look at this pie chart. You can see how our volunteers' participation during our COVID vaccine clinics. As you can see, it's over 70%. They are MRC volunteers, and 27% are staff member from public health division and town employees. Last, what we are going to do next, we are going to reorganize our supplies, so to be ready for next operation in coming days or weeks. Thank you. This is my update.
Great. thanks. Board, does the board want the slides shared, or do you want to just go through the packet? I don't know. I have a split screen, so it's harder to see. It doesn't matter.
Yeah, we don't have to share the screen for these.
Yeah, right. Okay, that's fine. And we'll go through in order. I think that makes sense. So great. So next up, I guess, is nursing Tiffany. She's not here, right? So I don't know if there's an update on anything in there.
Yep, Tiffany's on vacation, but we do have Hannah here to go through it with us. Hannah Burnett and Hannah Whitehead here, and Mary. Hannah Burnett, would you mind starting us off?
Yeah, no, not at all. So nursing, we have been continued with the COVID disease investigation. Mary is heading that department. We have done the vaccine, continue to do the vaccine. We've done the total of almost 7,000, helping with the reopening guidance and educational efforts for different town organizations and staff. And then we have started the summer camp outreach, just connecting with the previous camp owners about the changes in the guidance for this upcoming season. The camp applications are due at the end of this month, and somebody emailed me yesterday and said they're dropping off theirs today. So we'll see how many camps we're going to have. As far as the reports of other communicable diseases other than COVID, we had 3 cases of Campylobacteria. They were all looked to be related to foods consumed and not cooked properly. We had 4 Lyme diseases. We had, I know the report says that we had total of 7 TB cases. That is actually not correct. I have been on the phone with the state, 3 different people. We actually have one, and it's a B1 visa person who was, it was screened prior to them coming to the state or to the country. They are being followed with their PCP. The other 6, and this is a quote from them, is it's an electrical system, so many things can go wrong. In that they did not know about any of them. They said if we have that many active cases, or even if we have 1 active case, they will definitely let us know. They're going to look into it just to see that we can get it off of our reports. But it is not as bad as it looks.
Can we take it off of this report? Because this is our own internal report here.
Yes, I believe so. The epi for the state's TB is going to, he was on his way to work actually when we talked this morning, and he said he'd give him about an hour or 2. He's gonna look into it and send me an email, and I think after that we can definitely take it off once it gets confirmed, if the board is okay with that.
That's good.
Okay, and then I think that was it for the communicable diseases. We continue to give, we have 2 residents that we continue to do B12 injections monthly. We used to do both of them in home. Now one of them is able to come here. We continue to go visit the other one every month. Gift of Warmth, or the assistance programs that we're doing. So Gift of Warmth, we have so far in this season helped total of 20 new households. 16 of them have been completely new to the Gift of Warmth program, all related to COVID, loss of income and loss of employment. And as you know, it is completely donor-based program, and Community Council has continued to be a massive support for us. And then we also get donations from residents, and that's how we're able to help people.
Great, thank you. Any board questions for all set?
I have a couple questions.
Okay.
Go ahead, Christina.
But I was just wondering, you said those campy cases were all food related. Were they all at one location, or?
No, actually, two of them were definitely food related, that the people already knew what they had done. The other one were suspected food related. They were none of them were connected. One had to do with raw eggs, as in cookie dough, chocolate chip cookie dough. One had to do with a liver, uncooked liver. And the two other ones, we don't have a clear understanding what it was, but they were both followed with their doctors, and they thought that it was just something that they ate, but they couldn't pinpoint it to a specific thing.
Okay. And then I just had one other question in your report. It says that you've been involved with Hvac. Is that the Domestic Violence Action Committee?
Yeah.
And it says
Yeah.
educational events with Rep Garlic and working on fundraising. And I was just curious what you're fundraising for and what the needs are.
Sure. So, and Tim, do jump in if I'm saying something wrong, as I'm kind of new to this. But the Hvac it's the Domestic Violence Action Committee that was established many years ago. And we get some funding through the annual trust fund from that. And then we have a donation account. So the needs are, so I think our role is to raise awareness and help people find resources if they are in a situation where they need that. And also just to educate the community how we can all be support and resource for others. So the fundraising part right now, we're doing a Mother's Day drive. We're working closely with Reach from Waltham, and they have identified 30 mothers who are survivors of domestic violence. So we're doing a Mother's Day drive for them for certain items that they need. It has not been launched yet. We're working on the flyer, and we're gonna definitely advertise it and hope to get a lot of community support for that. And then another one is in the works, again, has to do with raising awareness of domestic abuse in Needham also. And that is, we're hoping, that's something that we're working towards when the governor, we have this idea that when the governor says that no masks no longer needed, we kind of tying it up to that. So I don't have that much, I feel like I should not say too much about it because it's something that we're working on.
Okay.
And
Yeah.
I would like to say that we have received here in the nursing office increased number of calls from residents who are concerned about those who might be experiencing more abuse now that people are indoors. So that's where we're working on this webinar really with Reach again. It's called What to Say, What to Do in the event that you are in a situation where you see something or somebody discloses something to you, just so that people would have really concrete things that they know what would be helpful. So that's something that we are going to be running in May, and we're working with the Needham channel in regard to advertising it.
Okay. And what would you say the numbers look like in terms of cases you're getting, calls for?
So since February, over 5, less than 10.
Okay. Okay, that's helpful to get a sense of.
One of the things that I think the board knows is that the Domestic Violence Action Committee is largely funded by a trust fund donation that was made by the Bigwood sisters, two sisters who lived in Needham for a long time, who died in the late 90s, early 2000s. I'm actually forgetting off the top of my head. And that produces about $5,000 to $6,000 a year in interest income that the committee uses to support its activities. In some instances, there are additional activities that they want to do or additional programs they'd like to support. And that's where they try to raise additional funds. There's a small donation account, which has a balance of 15 or 17,000, something like that. So because the trust fund money comes in every year, we try to sort of live within those means and then only use the donation account for sort of other sort of extraordinary expenses because very little money comes in.
Okay. Yeah, I just wanted to suggest that, we have a very generous community here, and I have, I wondered if you'd ever asked the community if you did need funding for this work, because I've noticed, that there's a group, Equal Justice Needham for Families, and they started this program called the Lunch Equity Project. And I think in two weeks almost, they raised about $6,000. And so I feel like I've seen other programs like this in town where our community is quite generous when there are, specific needs and asks that we request. So yeah, I think it's something to keep in mind if you do need funding.
Great. Okay.
Definitely.
Thank you.
Sorry, Rob, did you have something you wanted to ask?
Yeah, I was going to suggest that we add the COVID vaccinations to our immunization log there, just as a record of what was done. We don't know yet, but we may be continuing to do this year on year. So
Yeah, that's a good idea.
Yeah, that's a good idea.
Great. I guess, Carol, if there's any big updates, you have quite a detailed memo here, but.
Hi, I'm just listening, excuse me, to the state call. Yes, I list all the things I do because I'm responsible to put a quarterly report into the state. So I will transfer all that into the state as my monthly activities, but thank you. And primarily I have been dedicating time to support Stephanie and Tim in the efforts they do with town staff and COVID positive and COVID exposure related to leave and their health situation. It was a privilege to work at the last vaccination clinic, and I also have spent a fair amount of time working with the new law enforcement social worker, talking with her and the police and making the stakeholder connections for her to be able to have more open communication with CAF social workers and public health nursing to utilize her. We share her with Dedham. So she's in Needham 50% of her time and works 1 to 9 and has really, now she has a radio and is making her way into being able to be more proactive on resident calls that we have that are consistent for mental health and substance. And I've just been maintaining my SAPC grant town attendance and coalition meetings. So thank you.
Karen, I guess. Hey.
Good morning.
Hi.
The month of March was highlighted for our Substance Prevention Alliance of Needham's quarterly meeting. We held an educational event for the community. It featured Dr. Safdar Medina and a presentation on cannabis in the teen brain. We were fortunate to co-host this with our coalition neighbors in Natick, the Natick 180 Coalition and the Natick Public Health Department. We have found some collaboration with some of our neighboring coalitions, so I'm pleased to report with Natick. We had 70 people attend this morning event, and we received 22 surveys back with very favorable reports on the content. Dr. Medina did a really excellent job. The landscape around the risks of youth use in marijuana. We've continued with our vaping grant. As you have heard me in previous months, our cessation program up at the high school is under full promotion now. While it isn't being as actively utilized as we had hoped, it's understandable with the hybrid learning environment that we've had all year. The good news is we feel as though we have a strong platform for promotion, not only through the end of this year, but then again, making a real booster of that promotion in the fall, hopefully with students returning full time. And we couldn't have done that without the dedication and the support of the health office up at the high school. The school nurses there are the ones who deliver that program, and we're really grateful for their commitment to that. On another note, from a data collection standpoint, we conducted 2 student focus groups last month, and had planned also for April for parent focus groups. I'll touch on that later. But this is an effort to collect some qualitative data around substance use behaviors and attitudes and perceptions. And we were fortunate to get into 2 wellness classes up at the high school, so we could collect some of that from students. We conducted mental health first aid for youth in March for a group of people. So I'm pleased to say that we are, despite the pandemic, offering that virtually. And we also did some virtual youth development training for our SALSA students. They attended a 6-hour program hosted by Dover Youth to Youth up in Portsmouth, New Hampshire. So we're very pleased to be developing the advocacy and presentation skills of that group, especially as it relates to peer-to-peer education around substance use. And then finally, I may have mentioned this previously, but we have been awarded the STOP Act grant, which is a 4-year grant from SAMHSA, the federal government, and it's specifically dedicated to underage drinking. And we will be starting that grant very soon this spring. It starts in May, and there'll be more on that later, but we're just pleased to be the recipient of that money. As I said, it's a 4-year grant, so we're very excited. Thank you.
Great, thank you. Let's see.
Congratulations on the grant. I just wanted to add also that I really think that the work you're doing on cannabis and the teen brain is really important and timely because, you know, from my perspective as an emergency physician, I'm seeing a lot of cannabis on the teen brain, and especially in its intersection with mental health. I'm just shocked at how many teen patients I see with mental health issues in the emergency department have tox screens that are positive for cannabis. So I think that's really great work.
I want to also chime in and say congratulations on the grant. And I think it's very timely.
Great, thanks. More to come on that.
It's exciting. It might be, maybe someday we do a community forum or something, Rob. You might have, that might be a good topic for the community.
Sure, definitely.
Absolutely.
That's great. Let's see, on to environmental health. You guys have been busy, I see.
Yes, thank you. All right, I'll give a few highlights, and I'll have Diana review the pool updates, but I'll go on to the well regulation. So we've been, again, busy working on these regs and did a complete overhaul basically. And we met, Diana and I had a Zoom call with Sean Harrington, the superintendent of water and sewer yesterday. And he had a lot of good feedback on some sections that we can tweak to make that align with his well pre-operation inspections. So we'll be working with Lynn again on that, if she can help us. And then we'll have probably a draft ready for next month's meeting, we're hoping. If we have room on the agenda, we could go over those. We also have been busy working with some housing. I'll give a highlight on one of the housing items that Diana and I have been busy working on is St. Mary's Street. So there's a house at the end of that road that we've been working on many years, and select board, so Sandy Sincata, the building commissioner, David Roach, and health has been meeting with the homeowner every other week to review the progress made of removing the items off of his property. We went a couple of weeks ago and he did dramatic removal. So it was like he took 4 loads of truckloads off his property, which is the most we've ever seen him do. And we're trying to keep him motivated. We're trying to say, okay, this is great. Chip away at the other sections of your yard. He still has some items in the backyard and on the left side of his property. So again, I think he looks forward to meeting with us every other week to keep his motivation going, to keep removing those items. He was a little under the weather this week, so we gave him another week. We'll meet with him next week again to his progress. So we hope that we keep that going. And the other items, so again, I've been busy working with the call staff. I know the calls have dramatically decreased, but we're still getting inquiries on homebound inquiries. So I'm funneling the list of homebound inquiries to Hannah and Tiffany, and we're adding those to the master list. I know we've now had to stop our program while we investigate the J&J vaccine, but we're still gathering names and adding those to the master list so that they can be called back and see if they're eligible for these vaccinations. So those are a couple of highlights. And Diana, if you want to continue with those.
So this year, like you guys know, we have been using Viewpoint Cloud for our permitting system. Our first renewal reminder was sent out by the system for our pool permits. It was a little bit earlier than anticipated, just because those permits were expired. I'm thinking the next one that's going to go out will be the animal permit. So that should be an automatic reminder because it's sent out X amount of days before the permits expire. So that'll be exciting because that's one less thing that we have to worry about, like making 1,000 letters and sending them out to people. So that'll save us some time. The state had released some updated pool guidance. It's pretty similar to what was done last year. So with the renewal reminder, a lot of the outdoor pool operators had already reached out to me, so they know to start working on their applications. And we're just asking, the additional thing this year is to include COVID protocols. So last year, what I did with the pool operators was print out the protocols that the state had sent out, and then I read it to them as we were doing the inspection, had them sign off on it. This year, they can do something similar, or they can create their own protocols, and we'll go back and forth to make sure that they're meeting the guidance set forth by the state and just that they're following the guidance so that we don't have any outbreaks or anything at the pools. I think the biggest update was that this year they're allowed 50% capacity, but the rules pretty much have stayed the same otherwise. So still wearing the masks when they're on the deck. The only time not to wear masks is when they're actively swimming. So we'll see how that goes this year, but we sent them out early, so we have plenty of time. I think they're looking to open the last weekend of May, so we got a lot of time. I think any other big updates? Is there anything that the board wanted to discuss in more detail? Because I feel like everything's kind of standard.
Anyone have any questions?
Okay.
No.
There was one thing that I was noticing in the planning board special permit reviews. And one of the things that in town that seems to have gotten a lot of attention is the second point on there that says project site plan special permit proposal at 1688 Central Ave. Which is, I think one of our select board members is helping a current daycare center, the Needham Children's Center, expand their facility to this location. So I guess a home is, being torn down. It might have already been torn down, and they're building a daycare facility out there. And it's just gotten a lot of pushback from the neighbors in that area. But I was curious what it says comments sent. I was just curious what the comments were about that.
Yeah, I'd be happy to forward. I went over these with Tim, and they were very detailed comments. Mainly, the regular comments that we would make on these. Like if they have food service, we have to make sure we have a permit in place if it's eligible for a permit. These are the typical items because we don't know if some daycares in town do have snacks for the kids, so we have to permit them depending on if they're prepackaged or if they're open food items.
Mm-hmm.
That was typical. There was another comment we added about a potential, event that had happened. Fire had a file that there might have been some, the previous homeowner was using it as like a place to fix cars. So there was a fire report on that. And we just basically said, make sure that there's no environmental impact concerns on the property for the future property use. So we had sent those comments off to the planning board, which they get to the applicants. So, but I can forward you what we sent to them if you want to copy that.
Sure.
Sure, Tara, and the board might not be familiar with how often we do get these requests for comments. The planning board will send us almost everything that's built in town for comment. A lot of times they're worried about runoff, stormwater runoff. If there's any septic systems involved, they're certainly concerned about the public health division's assessment of that. They're often worried about, as Tara said, sort of environmental contamination. So in this instance, we said if there's going to be a demolition, we need to follow all of the normal steps for demolition, which generally involve asbestos check, pest check, and Tara, I'm forgetting a third one, I think.
So we do,
Okay.
yeah, pest and asbestos are the 2 reports.
Okay. This time we did recommend, or I think we said we thought it would be a good idea for a soil test, given the fire department's record of essentially used car repair. We don't have a record of any specific environmental spills on that site. So the Public Health Division maintains property records for almost every property where we've ever had to be involved in town. So property records could include an environmental hazard, a fire, a report of hoarding. But we often get, when someone's buying a property, often the insurance company will come to us and essentially ask to look through our files or get copies of our files to look at, what is their client buying? Is there any soil contamination? Is there anything else that might sort of throw up a red flag or question the value of the asset? So for this one, we don't honestly, we focus entirely on sort of the public health implications of any sort of change. So the fact that neighbors may or may not be concerned about it is less relevant than, say, if it is released, if it was something that, like, it was a factory that was releasing smoke in a residential neighborhood, that would be a concern. If it was something that was would create a nuisance hazard, like if it was a hog smelting plant and would create a very foul odor and it was being sited in a residential neighborhood, that would be a concern. So most of the time our comments are very simple, and it's sort of like, reminder, you need to follow these rules, reminder, you need to do this step. With this one, it was a little bit more complicated just because of the residential neighborhood and the fact that car repair was done previously. And historically, we found that many, not all, but many businesses like that did not properly dispose of chemicals, especially in the pre-2000s, the 80s, the 90s, certainly the 70s. So a lot of times it was just dump it out back. So we did recommend sort of an extra level of scrutiny to the planning board. Planning board doesn't have to take our comments into account, but they almost always do. There are some specific circumstances, Tara, where for like an off-street drainage bond that we require the planning board to take into escrow certain deposits from the developer or the builder, basically as a guarantee that their property isn't causing water hazards and water runoff to a neighboring property. That by building this up, they're not essentially flooding their neighbor's yard.
And that's for subdivisions, right? Yeah,
Thank you. That's helpful.
but I could send them to you.
Yeah, I just want to mention too, given that you had, who knows what kind of auto repair out there, there might be leads in the soil from batteries or even from paint. So I don't know if we want to check for that as well.
Sure, we could amend that. I don't know what actually is what they would get in a generic soil test, but we could sort of add that as a late comment, Tara.
Yeah.
I know
I mean,
that
given that it's going to be, yeah, I'm sorry.
No, but given that it's going to be a child daycare, right?
Exactly. Yeah.
Yeah, they'd be testing for metals anyway. They would do a whole suite, I think, and then petroleum hydrocarbons and all that would make sense.
We could verify that, make sure.
That would be good. Yeah, thanks. Great. Okay. Traveling meals had a big jump. Wow. Another, 250 more than last year for this month. Doesn't look like Mary Ann's here. I don't see her.
Yeah, she's on vacation. She gave me a little bit of an update. So yeah, she basically, yeah, so their numbers are going up again. More people are going on to the program. She said there really weren't many events that happened. So business as usual, as she always says. She did have some cookies that were distributed to the volunteers as an appreciation thing that she had done. So she wanted me to mention that as well.
That's nice. That's great. Yeah, I wonder what the increase, I mean, it's been a long year and people aren't hurting. Okay.
At some point, I'd love to know kind of a breakdown of who's accessing these meals in terms of, are they, because it seems as though just anecdotally, it seemed to be just all elderly folks, but I wonder, are we now seeing more families?
Sure. So,
yeah.
So for the, and I think Ed actually got part of this discussion last night. We are concerned about managing right now the aging services division because of the pandemic sort of essentially has a whole food security wing now. They do lunch deliveries, what would normally have been the lunch program at the senior center. They do fresh produce deliveries, they do grocery deliveries. And one of the things where we're going to have to plan for is as eventually the pandemic abates and sort of normal operations resume, we're not going to be able to probably do those delivery programs out of the senior center because we're going to try to restart the lunch program on site. So one of our questions and concerns is what is the impact then on the traveling meals program? The traveling meals criteria are fairly strict. It's not income-based, it's not age-based. It's essentially your ability to provide for yourself. So I've used in the example of past, you know, a businessman or woman in their 30s who doesn't have any loved ones nearby who has knee surgery. Well, it's not particularly realistic for them to cook, so they might go on the traveling meals program if they apply for, you know, 2 or 4 weeks until they're at the point in their rehab where they can, you know, stand up and provide for themselves. So the super majority of residents are older. We have some tension built in. Springwell, which is the aging services provider, it's contracted by the state for this area, often refers people to the program that don't meet the criteria, and we're constantly sort of working with them to say, here are the criteria. You're referring someone who can drive and, you know, who is very mobile and all of these things. So it's usually people who are without access to a private vehicle, or maybe are unable to drive because of their age or, you know, physical comfort with the ability to drive. So they can't get groceries in that way, or they have some physical limitations where they couldn't stand up and cook for themselves. So those are the general criteria that we have for the program. So unfortunately, it usually doesn't include families unless it's a situation maybe with older sort of grandparents taking care of young kids as well as themselves, which has happened once or twice.
And the other quick thing she wanted me to mention is that her summer job have gone out, the job postings for the summer. So we're getting applicants back for that as well.
I think one thing to mention to the board, or to remind the board, the traveling meals program, with the exception of Marianne, who works basically around the clock, is entirely supported by volunteers. The volunteers do the deliveries, they do, in some cases, the packing. In the summer, historically, and this is maybe, you know, something that is changing or will change in Needham. In the summer, historically, we've hired part-time staff, often school nutrition workers, to do the traveling meals program, because many Needham residents essentially go down to the Cape for the summer. So the residents have a second house and they aren't in Needham as much, and sort of the town empties out. I think that's changing a little bit. I do think we're also, I think there's always the question of whether we'll continue to be able to retain volunteers, because it is entirely dependent on volunteers from September through the end of June. Marianne works hard to get volunteers, works hard to make sure there's coverage from volunteers, but a volunteer run program is always tough. You know, if you're a volunteer, there's a, you know, if it's a really terrible weather day, I'm not sure you want to be out there. If it's, so I think that's one of our sort of challenges with the traveling meals program. We're always a little bit worried about its future, just because of those sort of items that are beyond our control.
How many volunteers do you need in the summer?
So in the summer, we have used 4 part-time staff. So it ends up being about 44 or 48 person hours over the week. In the sort of academic year time, for lack of a better word, we end up having about 70 something volunteers. Some people work, you know, every Monday they'll deliver. Some people will deliver 1 day a month. So on a typical like Wednesday, when we have maybe 45 meals to deliver, there will be, Tara, is it 6 or 7 routes usually?
Yeah, that's about right.
So there's 6 or 7 routes. We don't want to have too long a route because in general, the meals, except on extreme days, the meals are you know, taken from the kitchen, and we want to bring them and hand them to people. There's not like a provision for them to sit in a car for an hour and a half and worry about food safety. So the routes are pretty short, but we have a lot of routes that volunteers cover.
Yeah, and she has backups too to cover if someone calls out sick or doesn't feel well or has an appointment, has to reschedule. So she has that all set up.
But it is, it's not an exaggeration to say that Marianne is incredibly important to that program. And I think we want to figure out how to give her a little bit more security and backup for when she does take time off. She doesn't take much in the way of time off, but she's technically eligible too. So we want to figure out sort of ways to make the program not solely dependent on one very hardworking person.
Definitely.
Thank you. So I next have Lynn. I don't know if I can read these things. Does any board members have questions on these items? Board of Health job description, that was interesting to me. So I don't know if I don't know what that is.
So one of the things, and I guess I could jump in, Lynn, please jump in at any point here too. One of the things that I have had on my to-do list for the past couple of years is to put together a job description for each of the 3 boards that are under Health and Human Services. So for the Board of Health, the Council on Aging, the Youth Commission, so that if there are vacancies or if there are new board members, they sort of understand kind of what they're getting into. Not that we would, have a job posting for a board member. It would be, something that someone would run for, but it might help give them a sense, like what is the expected time commitment? What are the type of things you're going to work on? I think Jane Fogg always used to talk about how, I don't know if we technically can blame Ed, but Ed would lure her in with talk about, smoking and anti-tobacco and policy, and then she had to deal with chickens all the time. And there aren't that many chicken situations, but it is interesting, sort of the gamut of topics that are covered. So I think trying to give people a sense of that. I think as maybe the newer board members know, we did, and I'm going to forget the name of it, Lynn, but sort of like a Board of Health orientation folder with some materials pulled, a lot of it from Mass Association of Health Boards, some from MHOA, but to give board members sort of the sense of like, what are their statutory powers and responsibilities? What are the regulations that are already in place that the board has adopted over the course of its existence? What are some of the town policies? Just, I think, oftentimes when you have an election, there's a board, meeting relatively shortly thereafter. We didn't have any contested elections this year, but there were elections on Tuesday for the board. We're having a meeting, 2 days later, excuse me. So I think it's designed to try to make that a more seamless process and also to give people materials so that they can hit the ground running.
Yeah, that's a great idea.
Yeah.
I think it's also for the Council on Aging and for the Youth Commission where it's appointed. Those are appointed boards rather than the Board of Health, which is an elected board that you run for. We want people to really understand what they're doing. So this is what you're signing on for. If you're a Council on Aging member, if you're a Youth Commission member, this is sort of the topics that they talk about. This is the input they need. This is the advice you give, that type of thing.
Great. So we're running kind of late, and I see this huge slide presentation. Can we sort of, I assume board members have been able to review all of these. Are there any highlights or things to point out rather than run through every one of these, by age, we could sort of see the time trends. Is that okay, folks?
Mm-hmm.
Is there?
Just one thing.
Go ahead.
Before you start the slide presentation, I had my knee replaced just about 2 weeks ago, and the physical therapist is coming this morning at around 10. So I'll just disappear, okay?
Yep.
Thanks for letting us know. Yeah, I think the thought is to maybe somewhat skip. I mean, we're seeing similar trends from previous. I mean, Hannah, feel free to, give us your 3 points, but
Okay.
a lot of slides.
Yeah, I can, I think maybe focus in on some of the newer slides on clusters, and then vaccination coverage is probably of most interest right now.
Great, I'll pull those. You said clusters, there we go.
Yeah, okay, so these are the clusters from March. Like we've been seeing in past months, there's a lot of household transmission going on. More than half of cases can be linked to a household cluster. 129 cases. I think there was about 188 cases this month, which is pretty much unchanged from February. In March, we saw several clusters arising from social gatherings. So that's a bit concerning, 12 cases coming from that. A few daycare cases, that's definitely down from last month where we were seeing a lot there. Then congregate care is pretty low. So yeah, zooming in on congregate care, I think is just interesting thinking back to where we were last year. So on the left, you can see here both the number of cases linked to congregate care clusters. These are at the long-term care facilities and assisted living. So last spring, we were seeing a huge number of cases there, especially in April. And then the lower graph under that shows what proportion of the town's cases were represented by the congregate care cases. So that peaked again last April. 70% of Needham's cases were linked to these facilities. And that obviously went down over the summer and fall before kind of resurging a bit, with the entire second wave. But what I think is really promising to see is since January, it's really plummeted. I mean, there's been, 3 and 4 cases in the last 2 months, which to me indicates vaccination is doing what it's supposed to do. And turning to household clusters, I just wanted to dig into this a bit more since we're seeing so much household transmission. So on the left, you can just see kind of the distribution of how big these clusters are. So on average, each household cluster has 3.1 cases with a minimum of 2, which is the requirement for it to be considered a cluster, obviously, and maxing out at 7. And then if you look at the age distribution of cases linked to household clusters, you can kind of see the distribution. We have a clustering around children's age and then what I would consider to be parents. So just kind of it's consistent with what you would see in a family with ongoing household transmission. So again, household clusters, just looking over time a bit. So looking back to December, seeing both the blue bars represent the number of household clusters, and then the orange is the number of cases linked to those clusters. And the line above shows what % of Needham's cases are represented by these household cases. So that's going up. Household transmission is accounting for more of our cases. This is just an example of what a cluster can look like, kind of at the more extreme end, I would say. So obviously we're not going to get into any too specific details, but just showing that, one infected person, if they are attending social gatherings, it can lead to many subsequent cases. So the red dots are all confirmed cases. You can see kind of up to like tertiary chains of transmission. And of interest, I was checking into what data we had on variants, and 2 of the cases from this cluster have been sequenced and were positive for the B117 variant. So that may also likely contribute to why we saw so much transmission in this. But I think just a good visual for seeing how one person can really contribute a lot of cases down the road. I think those are all the slides on clusters, so I don't know if we want to just skip to vaccine coverage, unless there's anything else.
Vaccine coverage or Needham vaccines administered?
Maybe we can start with the clinics. I think it's a bit different from last month, so I'll just go through those really quick. Okay, so yeah, this is just data from all of the vaccine clinics run by the town. You can see we fully vaccinated over 3,000 people over about 12 weeks. So January to March. Yeah, so here's towns. This is kind of unchanged from last month since it's been mostly second doses. Just the gender age breakdown. Overall, it has skewed towards women. 60% of the people we've vaccinated are female, and a larger proportion among the women have been 75 or older, but it's fairly consistent between the 2 genders. race and ethnicity, majority white, but definitely some representation from other groups. Again, consistent. Okay, so turning towards vaccine coverage. So this is new data that's been put out by the state starting in early March. So this is vaccine coverage among Needham residents, totally separate from the vaccines we've been distributing. So this first graph is showing vaccine coverage over the time that we have data available. So you can see pretty steady increases in kind of across the board. So as of last week's data, this was updated last night, so it's probably even higher now, but over half of Needham's residents have already received at least one dose of the vaccine, which is great, and about a third have been fully vaccinated. This is just looking by age. So the black bars are showing the percent of that age group that is fully vaccinated. And then underneath that is just the kind of breakdown. But as you would expect, among the higher age groups, we're seeing really high coverage. According to the state, over 90% of our 75-year and older population has been fully vaccinated. And numbers are even starting to tick up among the 0 to 19 group. So it's great to see it's really reaching everyone. Race and ethnicity again, majority white, not very surprising there. But yeah, this is something we'll also track over time. Actually, I think the next graph shows it over time. So yeah, this is just looking at the race ethnicity breakdown over time, kind of, and then the percent change is over the 5 weeks that we have data. What's the percent change by group? So you can see the Hispanic and white group have had over 90% increase, so almost a doubling in the number of people who have been vaccinated. It's been a bit lower in some of the other groups. But again, we're seeing, you know, upwards trends, and presumably it'll level off at some point, but for now it's all looking great. So this is comparing Needham's fully vaccinated coverage by age to some of our kind of the towns we normally compare to. And you can see that Needham is kind of at the front or neck and neck with Newton across all of the age groups. Overall, we have the highest fully vaccinated rate, and for 75 plus and 20 to 29, 30 to 49, we have a higher percentage fully vaccinated than any of the neighboring towns. And especially in the older age groups, you kind of see Needham and Newton are kind of a chunk above the rest of the towns.
Thank you, Hannah.
Thank you, Hannah. Any board members have questions or follow-up?
Thought I had is that, Hannah, you've done such a wonderful job creating these wonderful visuals of all this data. And I wonder if we should consider sharing some of this with the public, you know, even on our public health, you know, Facebook page, or, you know, through the town's page, or however, because I think it's good information for the community to be aware of what all is happening behind the scenes here.
Great, yeah, I'm happy to do that. We posted onto the website, but it's kind of buried when it's posted there, so we can sort of call more attention to it.
Yeah, I agree with that. And, you know, again, I can't say enough about our own vaccine administration efforts, and the fact that 97% of the people that got the first vaccine got a second vaccine through us is phenomenal. Just shows how well run it was.
That's interesting. What do you mean? Does that not often happen, that people return to the same site?
We did lose some folks because the governor, after we had held a few clinics, the governor announced the sort of companion policy, like if you brought an old person, you could get the vaccine too. Mm-hmm. However, when we did the first dose clinics, if we had 700 people, we signed up those 700 for the 700 second dose shots. So we didn't have any open appointments for their companions. When that happened, some companions said, you know, I'm not going to bring my mother or my neighbor or something. I'm going to go to Gillette. So we lost about, I think 2 or 3 dozen, maybe 3 or 4 dozen people total.
And there's just lots of other reasons why people drop out, you know.
Right.
have reactions, they don't feel like it's necessary, and also, maybe logistically, but it just shows that people were motivated to do it, and it was a complicated thing, and we did it well.
And structuring that second dose, scheduling that second dose right when they're there is key, I think. So.
Yeah, certainly we learned that from the day when the state system was down. It was very challenging to go back and register the people who weren't able to be registered because the state registration site was down. That was a logistical challenge for us. I do, as Kathleen had mentioned, I do want to be conscious of the time because we do have one guest and we also have quite a few items to get to. If it's okay, Kathleen, I'd like to ask Lynn to just give a brief overview of the Health and Human Services Racial and Health Equity Policy Draft.
Great, thank you.
Sorry, I'm not, I don't have it with me, but you all have that in front of you, the policy draft. So this is in, thank you. This is in response to, obviously, to what's going on in the country, and it comes out of the committee, the Racial Equity Committee that we have in Health and Human Services. I thought it was important to put some little background in there about racism as a public health issue, and wanted to build into our process, considering how our work affects, how our policies and how our work is affected by racism or is anti-racist. And well, you've got the draft. If anybody, I think questions would be better for me to answer. I was on vacation earlier this week, so.
I have a couple of questions.
Not entirely here, yes.
In purpose, I'm wondering if the first paragraph is necessary at all. It's inflammatory in some ways, and I think the second paragraph gets to the purpose anyway. In the second paragraph, you list a number of inequities and biases, and that list is different than the number that is listed under policy. Different list. And I'm wondering why that's a different list. And I'm wondering why creed is also not listed in either of those, which I think also is an important issue that should be addressed in terms of health inequities.
Sure, I think we could certainly do that. It is still a draft policy, and we haven't reviewed it with the board yet. I think, as the board knows, we've been trying over the years to formalize more of the work we do, so that there are, very specific policies, so that if someone leaves, all of our sort of subject matter knowledge and all of our practices don't go out the door with someone. So this is supposed to help set a framework for the work that we do. I think, there's a policy at the end about updating policies in the packet, which is my favorite policy. But I think we can certainly take a look at this policy and make additions and changes, and I'd love to get feedback from the board in more detail, and we could bring it back next month to discuss further.
Sure.
Certainly incorporating creed and making sure that we're not sort of leaving out any important categories or areas would be definitely something to do.
Right. And have we costed out procedure 4 for interpreters?
We have some data from this past year. The cost of interpreters is comparatively modest for written translations. It's more expensive. So depending on the length of document, it adds $75 to $300 to $400 or $500 to the cost of a document if you have to have it written, the written document translated. It's more challenging when we have public events to have translators available. So I do think we want to figure out ways we can sort of allow people to request those. If we don't, I think it's a question, like, for example, should we automatically always have translators at public events, regardless of someone says, I will need a translator? Personally, I would prefer that, but that might be an area where financial considerations have to come into play somewhat. That we can have, translators on demand rather than translators always universally there. But we we do have some flexibility, and I think it's something that we can do in sort of a very, it's sort of a fairly modest step that we can take towards this. I know, for example, a lot of the documents the Public Health Division has been distributing to town employees and staff, we've been translating into Spanish and Portuguese so that they are more accessible to largely to the building maintenance staff for the town.
I think the written is going to be easy. And I'm certainly not opposed to having interpreters. It's just, working with them frequently in the hospital setting, they are extraordinarily expensive. So if we were to have a public event, and because you don't know who's going to come, you wanted to have in the room a Mandarin, Russian, Spanish, and Portuguese interpreter, all interpreting simultaneously, which also can, slow things down because you have to, wait for one, the other, and the like. It will be extraordinarily expensive. So I just wanted to make sure that had been considered before we go out saying that, yeah, we're going to do this.
So I wanted to say a little bit of something about how we've used interpreters in the past. When Rachel Kane was doing the presentations at the Housing Authority, what she did was she arranged for a Chinese interpreter for one evening, Russian interpreter for another evening. And so we invited Chinese speakers and Russian speakers specifically to those events. So we did.
That could be seen almost as discriminatory, couldn't it?
I think the intent was that we were holding the same content twice, and we, essentially English and Russian in one, English and Mandarin in the other.
I understand that, but you're segregating the population over a topic of common interest.
Mm-hmm. Okay. I do think I think this is certainly one of the more complicated because it involves both logistics and finances elements of it. I have mentioned to the town manager and the assistant town manager that I think if this is something the town is committed to, there should essentially be a central fund from which the town or departments within the town can make their written products or their public presentations translated so they are accessible. I don't know if it makes sense to have the Health and Human Services Department, because we sort of touch people most often, be the one that has a translation account. And then, if the DPW decides they need it, they have to ask us to translate things. I don't know if that makes sense. So I have asked the town to consider whether there should be a central fund for translation.
Right, I agree. I would almost push for that because it also gets it off our budget, Tim. Mm-hmm. And that's going to be a tough sell with the finance committee. It's better if it's coming from the town and is a town-wide resource.
And it would be consistent too. I mean, you could have like a very good translator in one place and a not very good one somewhere else. I could see it, consistent. We're getting behind. So is this a situation where we should review this and give comments, or be prepared to bring comments at our next meeting, or?
I think that would be great if the board was willing, either written comments and then we can discuss the next meeting, or to bring the comments to the next meeting.
Okay, great, sounds good. So unless there's any other board member questions, I think we should move on to the Noiri discussion. And are we expecting a vote on this today?
No, I wanted to make the board aware of it. It's something that will come up at town meeting for a vote. So the Needham Unites Against Racism Initiative is a group that's been working, I don't know if it's for a year and a half now, to sort of assess how the town is, in the same way sort of Lynn talked about for Health and Human Services, is advancing sort of policies and practices that are equitable and fair. And so the select board, which has been very involved with Noiri, came out with this sort of vision statement, guiding principles, and intentional practices, which is the 3 sort of pages after the memo in your document. And then there's a draft report for town meeting. So I just wanted to give you a little bit of background if the board was interested in looking at it. The select board is hoping that boards will choose, and I don't know if they want it to happen before town meeting or after town meeting, to also adopt the vision statement and guiding principles and intentional practices. I think that's something that sort of the board should look at and discuss. I think the Noiri group was fairly limited in its membership. We had staff that asked to be a part of it that were not permitted to. And that's in part that's actually not why. We had already started some of our health equity policy work, but I think it's worth sort of having a future discussion. So I wanted to sort of, in part because the select board requested, in part because I think it's an important topic, wanted to bring it to the board's attention and see if, like our policy, we could have comments and discussion next month in detail.
Mhm.
I think one thing that jumped out to me about this was that there's key takeaways and recommendations for a lot of different groups, including boards, but you know, it did include like police, schools, housing, but not public health. And I wondered why that wasn't in there.
Yeah.
Yeah, I noticed that too. I kept searching for health. I mean,
Yeah, I think the fact that we're not even represented, you know, I don't mean the board, but someone from public health is not represented in Noiri. I mean, a place like public health where we have so much data on health disparities and that's something I did advocate for, that someone from this group be in that, but they were not too keen on that.
And do we know the details of why 2 members stepped down? I just don't know if there was some discord amongst the members.
I do not. I know that there was some press coverage that some of the meetings were robust in their discussions, but I don't know why 2 members stepped down. I don't know if that was out of controversy or the commitment was different than they thought or something.
Mhm. The other thought I had with looking at this is that, you know, with the intentional practices and things, I feel like, you know, if there's a lot in this, and I want us as a board and, you know, HHS to really think about, can we really commit to all of these things and not just sign on to something that, you know, that they are urging us to do, but really ensure that we can meet these practices.
I agree. Like, I don't want it to just be empty. I mean, we've had this language out there forever, but you know, are we really implementing things to make a difference?
Right. Or should we create, you know, have our own that's actually, you know, kind of doable for our group. So.
Okay.
Yeah.
So we're just getting familiar with this, think about it and talk about it at our next meeting. Are there any other board comments or questions? I'm trying to keep pace. Okay. So I think we're almost caught up on our timeline. So now we're at, let's see, sorry, the next item on the agenda, I'm going up to the top, is the community events and business guidance.
Yes, and with the chair's permission, I'd like to promote Steve Corcoran to promote him to the meeting and ask Diana to sort of take over the introduction to the topic.
So I recently did a reopening inspection for Blue on Highland. They're coming back into business. I believe they already started doing their to-go and all that. So while on that inspection, we had discussed that they had gotten the 6-foot-tall plexiglass barriers to put in between the tables. Because according to the state guidance, impermeable barriers such as plexiglass can be placed between the tables in order to have them set a little bit closer than 6 feet apart. So that's what we wanted to discuss. And I see Stephen is in the meeting. And then Tara, I don't know if you wanted to add anything.
No, that's it. We've included a copy of Stephen's layout plan. I don't know if you have it in your packets. Current proposed layout looks like.
What we're missing there, Tara, are distances. There are no distances on that plan.
The distances are, hi everybody, this is Steve. The distances are, if you look in the left-hand margin there, it says all tables are 6 feet distance unless by barrier. So all the tables listed there are 6 feet apart unless you see either a black bar or a red bar. And the red bars would, you know, the tables in between there would be approximately 3 feet separated.
And the distance between, say, table 31 and 21 and 22?
That'd be a little shorter. That'd be about 2 feet.
Between 31 and 21 would be 2 feet?
I'm sorry, 31. No, that's about 6 feet.
Yeah, because the ones along the wall with the black barriers, those are the booth seating. that have the bigger
Those are
ones.
9-foot barriers. Is that the ceiling height, 9 feet?
The ceiling height's about 10 or 11 feet.
All right, so it's close, but
Close, right, exactly.
And those aren't a new feature. That's a feature that's been at Blue and Highland.
existing, yeah.
That's correct, that's existing.
I think one of the things that was helpful for me, Steve, was to hear a little bit about the work you've done upgrading your HVAC system as you guys get ready to sort of reopen and serve patrons.
Sure.
Can you tell us just a little bit about that? I know you had included it in your email, but.
Yeah, sure. So, well, first of all, I'm an operations manager helping the owners, Rod and Catherine Hvac, get Blue out of hibernation and get them reopened. And as part of that, the Hvacs are very committed to providing a safe and healthy environment for their guests and their employees. And so obviously we'll adhere to all of the state mandated regulations of mask wearing and employees signing in, having temperature checks and things like that. But they wanted to do even more than that. They wanted to exceed those minimum requirements. And one of the things they wanted to do and have done is to upgrade the HVAC system with the installation of air purifiers. There are 3 HVAC units on the roof. Each one of those units has received a air purification filter system, which according to the documents provided by that company, filter more than 99% of COVID virus via airborne inactivation with a photohydroionization technology. So in addition to other bacteria and viruses and things like that. So
Can you tell us how many air exchanges an hour that system is capable of?
You know, I couldn't find that in their test documents.
I'd also be interested in the actual filtration, those ionizers. I'm not in a public meeting. These companies sue scientists who speak against them. I'm not a big fan of those devices. They're not terribly effective. But if they also have put in, like a MERV 13 filters on their system, that's great. That's going to do more than the ionizer, likely. So if we know more about that, I think it would be good.
Kathleen, I mean, you're the expert in this area, but I think this technology is actually a UV technology.
Well, it's an it's an electronic air cleaner. So there's a spark and you basically, depends on the type, but you're creating reactive oxygen species is the thought. But the study was just published a couple of weeks ago that kind of shows they don't really.
Yeah, ionizers don't work. I was wondering whether the UV component of this, though.
Yeah, UV is helpful if the air doesn't flow past it too fast. So that's, it's like, I'd rather you move more air through a filter. We shouldn't, I don't want to get into the system. If they're meeting the ASHRAE guidance on the ventilation system, they've upgraded the filters, that seems fine. So I think as long as they're moving the right amount of air, that I think is fine. I'm not really that interested in the ionizer. It's a large volume. So any sort of hazardous chemicals or, reactive oxygen species in the space will be diluted. So I'm not really that concerned about that in this volume. I wouldn't want it in a school, in a classroom. But so now I'm probably.
I think one thing that is potentially helpful when we think about it, and we go back to Hannah's presentation, Hannah W's presentation, just the clusters we've seen in Needham haven't been from restaurants. And I think so what Steve Corcoran is here to talk about, I guess, is, Blue on Highland reopening. And I think people have been interested in having it reopened because it's a prominent restaurant. And what sort of safety measures they have in place to sort of protect patrons and staff. I think one of the sort of things that, the state has done is by having these requirements for distances or barriers, they've, sort of set standards for restaurants that they believe are safe and reasonable to open. And those standards, because of sort of the nature of design, means that those restaurants are operating below what their normal capacity would have been. And at least from my perspective, I don't know when a lot of states have gone back to 100% capacity. I don't know that Massachusetts will get there that quickly to 100% indoor capacity. I think some of the spacing and the barriers will be here for a bit. But at least for me, it was helpful to see some of the materials that Steve Corcoran presented and to have a chance to talk about them, because I do think they're trying to put safety measures in place to keep their staff and their patrons safe.
Understood, but it would be good to know what the airflow is actually like, because ventilation
Definitely.
is a key to this,
Yep.
and the number of exchanges per hour is a key element for that as well. I mean, if this is only doing, one exchange an hour, that's probably inadequate, right? I mean,
Yes.
you usually look for 4 to 5 exchanges. If they have 3 HVAC systems, I mean, I agree with Kathleen. You got 3 HVAC systems, should be able to handle 4 or 5 exchanges an hour with ease. And you put in a MERV 13, and I think that's pretty reasonable.
Plus you have open windows at the front too, so.
Yeah, I was going to mention that.
Go ahead.
They're big windows. Where are the windows on this diagram? And the warmer weather is coming. I don't know how often the restaurant keeps those windows open.
Sure.
Every meal. Could you comment on that, Steve?
Sure. So the open windows are, if you look on the diagram, between tables 11 and 13. And when those windows open, they're fully open to the sidewalk out front. There's no sill or window jamb separating them. So it's totally wide open. We'd like to have those windows open as much as possible, because it just adds such a nice element to the aesthetic of the restaurant. So those, if the weather's nice, we open those up.
Wouldn't be opening them today.
No, not today.
But so any other board members have questions or comments? I mean, I guess my thought is, that they're meeting all the requirements of the state guidelines.
I do think it would be helpful, Steve, if you could get back to us or get back to Tara and Diana, in the next couple of days or so with information about the filtration level and the air changeovers per hour.
Sure,
I think
absolutely.
But yeah, I don't know if other board members have questions. I think we really appreciate you talking this through with us, because obviously Blue is one of the bigger restaurants in town, and you guys had been, as you said, in hibernation for a period of time. Tara and Diana, I know, are very detail oriented, especially when it comes to making sure restaurants are meeting the safety standards. But I know that the board had questions about the plexiglass barriers in the past, so we were glad that you had the opportunity and wanted to come talk to us.
Sure, absolutely. So just point of clarification. So I'll definitely get back to the board regarding the exchanges per hour. Is the board's decision on the use of the barriers pending that information?
So, Madam Chair, if I could, I think the board certainly has the right to certainly make any decision it thinks is necessary to protect the health in Needham. I do think the state has sort of set a standard, and the board could have a stricter standard if it wished, but right now we don't have any data supporting that there is significant in-person dining transmission in Needham, in part because I think those safeguards are pretty strong and reasonable. So the board could continue to discuss it. I guess my thought is it's challenging for the board to choose to overstep the state without kind of data sort of supporting its decision to be strict.
Tim, I have one question regarding what you just said. You said that we don't have any data of transmission in restaurants. Have we had in-person dining in restaurants to this level at this point in time? Do we have a lack of data, or do we have data that that transmission does not occur?
We have had, to this extent with these barriers, no, we don't have data on whether those barriers have stopped transmission. We do have some data on indoor dining in that it's been allowed for, gosh, it's all blending together in my head, but at lower capacities, it's been allowed for months now. And we haven't seen clusters arising from indoor dining.
And if I could just add, these barriers are in place across the state of Massachusetts, as well as the country, over the last year since indoor dining was allowed.
Yeah, no, I think the barriers are reasonable. I think the height is appropriate for dining, particularly if I assume these tables are all sit down and not stool height, right? Stool height, you might need a higher barrier.
Okay, good point. So stools are at tables 33, 32, and 31. So yeah, I could easily make those barriers higher in that Those are high tops, 31, 32, and 33. The other
That's the only
6.
thing to consider. I think
Okay.
there is some guidance as to how high above the average person's head you want this to be, just to be protective.
Okay.
Well, the state guidance is 6 feet from the ground, right? So
Which would
anyway,
be 72 inches.
a little, if you can make it happen, it would maybe add a little, but
Yeah, I mean, I think but I think in general you're fine. Yeah, you've hit state guidance. I don't think we have a problem with that, but I think it remains to be seen whether or not we develop transmission. There are plenty of videos showing how the COVID virus, if it's the airborne part, will go right around these barriers. I think we just don't have enough data, but based on the limited data we have, I can't see why we would say no at this point.
and 1 in 3 of our citizens are fully vaccinated, so that helps for sure.
Agreed.
Yeah. Okay.
Terrific.
Great. Good luck with the opening.
Well, thank you so much.
Thank you for coming, Steve.
Appreciate it, everybody. Thank you.
Any other community events? Was there something else in this line item, or is that just the business guidance we were talking about?
Business guidance. Yep. I'm sorry.
Okay, that's good. That's fine. So community health needs as part of the Mass DPH DON process. I already forget what this is.
DON is determination of need. I think as some of the board members know, Steve and Rob in particular, when hospitals essentially wish to add services or add functionality like a new PET scan or something like that, the state has mechanisms in place to essentially ensure that this isn't going to inflate costs, but also to ensure that this is impacting public health, supporting public health. One of the ways they do that is that they require hospitals to dedicate a portion of the total costs of construction and renovation towards health needs in the service area, the catchment area that they're providing, based on essentially a community health needs assessment, community feedback on what the priorities are. As the board knows, Children's Hospital was approved at, and I'm going to forget if it was May or September's town meeting in 2020, to build basically an outpatient surgical center, sports medicine sort of complex with a couple buildings. The value of that construction is going to be significant in the hundreds of millions of dollars. So the determination of need means that there will be significant funds in the millions of dollars available to help address community needs community health needs in Needham and the surrounding areas. Children's has engaged or came to the Health and Human Services Department and asked to have a discussion about this. Obviously, their focus was both public health and youth and family services, given the population that Children's Hospital is anticipating serving. And they had a very, you can see the agenda sheet that Tara put together. They had a very simple, 4-slide deck, a lot of it being about what their commitment are and who they serve and that sort of thing. And then they wanted to ask some questions. We thought that it would be helpful to have the board participate in or think about these questions to help inform what the priorities should be that the town responds to Children's Hospital about. So what are the community's priorities? What are the community health needs in the areas of, generally thinking within sort of youth and family area, mental health, food security, nutrition, exercise, overall wellness, sort of maybe thinking in those areas. Yeah. See.
Rather than entirely reinventing the wheel, didn't BI Needham have to do a community needs assessment recently?
They did. Lynn is more familiar with it than me. I do know that a couple of the primary areas were actually in the elder sort of service area, that a lot were related to that. So I think in part, some of this will be new for Children's.
I think what I understood from that needs assessment too was that they're assessing, that survey went to current patients of BI Needham, right? No.
That's not the purpose of a community needs assessment.
So we participated in the process. So they hold focus groups and key informant interviews to sort of help determine, what the consensus among practitioners is of the needs in the community. So they would talk to the public health division. They would talk to the community council, the YMCA, you know, organizations like that. And so I don't have the results from the community health needs assessment from BI off the top of my head. I do know that elder sort of access to care was an issue, elder transportation. You know, it's interesting because I think, you know, Beth Israel, Deaconess Leahy Needham has sort of aligned its services to try to meet the growing healthcare needs of an aging population in the Metrowest region. And that's been somewhat overwhelmed by the closure of the Norwood Hospital that's really increased patient volumes there. Children's is, I think, looking at the different end of the spectrum because they're trying to create a sports medicine complex and they're looking to serve under 18 youth and their families. I think they're probably looking at kind of the unmet needs on sort of the other side of the age spectrum.
Right. Although a community's needs assessment is supposed to encompass everything.
It is. I think in reality, though, the hospitals try to tailor it to the things that they're trying to service. Yeah.
I think my one concern looking at the children's slide deck is that you know, when Children's Project was approved, it's a very specialized service.
Yes.
I don't want to see anything cannibalize the pediatricians that we have in town.
Sure.
Is that you know, when I look at the slide deck, they're talking about all sorts of stuff that a pediatrician would, you know, normally do in addition to the community stuff. And it's pretty clear from, you know, what you put out here that, you know, mental health and substance abuse seem to be, you know, two top areas. I think those are very worthy areas because they are, you know, nobody funds these things. So to get some additional funding from Children's on those two areas at least would be helpful, although I'm sure we could think of more.
Absolutely.
Healthy eating and fitness for kids. So it's been a rough year for diet and exercise, I think.
Absolutely.
And I think safe communities and injury prevention
Mm-hmm.
would be huge. Again, not very well funded, but that would definitely be an issue for our kids here.
Yep, absolutely. If it's okay with the board, I think, you know, we've almost sort of set the table this meeting. I will follow up because Mary just texted me with the link to the BI Community Health Needs Assessment. So I will send that to the board to take a look at. And then maybe next month we can have a little bit of a more detailed discussion on some of those topics and what support and assistance might look like. I know one of the things that we often use to determine community needs is the results from the Metrowest Adolescent Health Survey, which because of COVID was not administered. They essentially decided to take a pause because sort of COVID changed who was in the building and how, you know, how data was presented and accessed. So I think if it's okay with the board, we can, the board can do some thinking and we can have a more detailed discussion about its priorities next month.
Yeah, great.
Okay.
So we have a few items on here that we haven't quite gotten to. So let's see, HHS Department Annual Report. Well, that's just for us to review. And some of that was presented the other night at Select Board, right?
Some of the COVID work, yeah, certainly was included in the annual report. But yeah, I did want to make the board aware of it. You will see it at town meeting as part of the packet. Certainly the other two items are things we could table or more were in the notification category that they're, you know, as usual, the Norfolk County Mosquito Control District is going to apply larvicide to contain mosquitoes. That's something the board has encouraged and approved of. We've always gotten good service and responsiveness from Dave Lawson and his team. And then the board, as I mentioned, policy on updating policies. It technically is the policy on updating regulations, but the board has adopted a number of regulations over the course of its existence, and we want to establish a process where we assess them, you know, on a regular basis against, you know, new and developing science, new data, and make sure they're still relevant, so that we don't have any sort of vestigial tail regulations out there. I do know, Madam Chair, that typically after the town election, at the board meeting after the town election, the board often chooses to reorganize itself. As a reminder to the board, the chair of the Board of Health is a town meeting member by virtue of his position, so that there is benefit. I know Ed isn't here, but Ed is a town meeting member as well. There are a few items that might be of interest on the town meeting warrant from the Board of Health perspective, including, in my opinion, the public health consulting warrant article, which the select board voted to support. The finance committee tied at 4-4, and we'll probably have a revote on next week. That's one of the main items. I think certainly the public information officer has been valuable to my team, especially during the COVID pandemic. I think there's certainly more work to do, but I've found working with Cindy Gonzalez to be really valuable. There's also, and it's something that Carol has done a lot of work with. She mentioned the law enforcement embedded social worker, the co-response model. The fact that the police department shares a 40-hour-a-week social worker with the town of Dedham's police department. That's something that my team and I had worked with police and wrote a grant. We applied to the State Department of Mental Health to get the grant. We weren't accepted. But the Chief Schittler and Chief Don Tremont and Dedham went ahead and found money in their budgets anyway because they thought it was a priority. I think that's a great thing. I want a full-time person, not just a half-time person, but I think that's a high priority to meet community mental health needs. So I think there are a couple big items that are on the town meeting warrant that the board would want to weigh in on. So the chair, would certainly represent the board at that meeting and would also lead the board generally for the next year. So normally the chair would say that she wants to entertain a motion and someone would propose, okay, I nominate so-and-so as chair and generally so-and-so as vice chair. The Board of Health has never really had a secretary. The select board has, a chair, vice chair, and secretary, but the Board of Health just has chair and vice chair.
Yeah, we're a little bit in uncharted territory because this is the kind of the first time we're doing this with a 5-person board.
Sure.
Because in the past, what we've done is we've put the two people, or the single person up for election in a leadership position. So that's why this year Kathleen and Rob. That said, I think that I would nominate Rob to be chair, having been vice chair over the past year. I don't know if we want to choose a vice chair at this point, only because Ed might be interested in that position. He's not here, but I think getting Rob on as chair, we could do now, and then he could represent us at town meeting. Assuming you want to do this, Rob.
As host of the meetings, an objection.
Happy to do it.
I'd be happy to second that motion.
Okay, all those in favor will go around. Steve?
Yes.
Christina?
Yes.
Rob?
Yes.
And Kathleen, yes. Yeah, great.
And just so I have another desk to dump on with this job, I want to make sure that we do suggest a vice chair and vote on that soon.
Absolutely. The board does, instead of having one meeting a month, it does have its COVID focused meeting, I think in less than 2 weeks. So I'll confirm with Ed, but that's something we can have on that agenda, certainly.
Great. It's a good plan.
Okay.
So Rob's the chair now, so do you want to take us out? We all set? Is that correct?
Yeah, I think Rob needs to entertain a motion.
Okay, I'm looking for a motion to adjourn. Do I hear a second?
Sure, I'll second that.
Okay, and let's take a vote. Kathleen?
Yes.
Christina?
Yes.
Steve?
Yes.
And Rob is also yes. So the meeting is adjourned. Thank you, everybody.
Thank
Thank you, everyone.
You all.
Thank you. Have a good day.
Thanks.